In this video, I would like to talk about various causes of anemia for normocytic and macrocytic red blood cells. If you haven't watched my previous two videos, please be sure to watch them before watching this video. Also, please be sure to subscribe and like my channel. That way I can provide more great videos for you guys in the future. Hope you guys enjoyed this video, and again, please be sure to watch the previous two videos on analyzing a CBC report, like how to read a lab report, and then also my other video on the reticulocyte index, where I give a definition and provide a few cases of microcytosis, where the reticulocyte index is less than 2%. So if you guys enjoy this video, please subscribe and like my channel, and please stay till the end of the video because you're gonna learn a lot of new information. Let's get right into it. In this video, as I mentioned, I'd like to talk about normocytic and macrocytic anemias that belong to this underproduction of reticulocytes and red blood cells. So if you have an index of less than 2%, what are some differentials for these two columns here? So for normocytic anemia, you can actually have things that mimic the other two columns. So you can have iron deficiency. Now, I mentioned that iron deficiency anemia is a microcytic anemia, but in the early stages, it can be normocytic. So I'll put this right here. Also, B12 or folate deficiency. So B12 or folate deficiencies can actually cause a macrocytic anemia in this column, but in the early stages, it can be normocytic. So it can be in this column here. Now for iron deficiency anemia, we talked about the tests that you can do, which are the iron studies. For iron deficiency anemia, I already mentioned some of the studies that you can do. These include the iron studies. So if you get low ferritin and low transferrin saturation, that's indicative for iron deficiency anemia. But how can we test for B12 and folate deficiency? Well, very simply, we can check levels of B12 and folate. Check levels in the blood, and if they are low, that's indicative of deficiency. But what happens if the levels are not low? If they're normal, or even if they're like borderline, then you can check two markers, and maybe I'll do a separate video on this, but you can check two markers, and these include homocysteine and MMA, methylmalonic acid. If both of these are high, that's indicative of a B12 deficiency. But in a folate deficiency, homocysteine will still be elevated, will still be high, but MMA levels will be normal. So that's how you can differentiate if you have B12 or a B9 folate deficiency. So checking homocysteine and MMA is extremely important to determine if someone has a B12 or folate deficiency, so that you can differentiate the two. Then you can also have thyroid and liver problems. So you can have thyroid issues like low T3 and T4. You can have hypothyrodism. If these are low, you can also check your liver, check for liver failure or things like cirrhosis. That's really, really important. And then you can also do a bone marrow biopsy, so you can check your bone marrow function if the reticulocyte is very, very low. This is mainly if the reticulocyte is very, very, very low. You can have different types of anemias where you're not producing enough red blood cells. Remember, the reticulocyte index was less than 2%, and all of these were normocytic cases. So again, you can have an iron deficiency in the early stages. You can have vitamin B12 or B9 deficiency in its early stages. And then you can also have thyroid issues and liver problems in normocytic anemia as well, in addition to kidney problems. So if you have a reticulocyte of less than 2%, check your thyroid, liver, and I'll mention also check your kidney. So you can check for kidney damage using things like BUN or creatinine or a low eGFR, like low filtration rate, to check for issues with kidney function. And also if the kidney is not working properly, you're going to make less red blood cells. And if your liver is working worse, also, because both of these make EPO, if you guys recall. So if there's problems with these, it kind of makes sense that you can get a lower reticulocyte count, so the RI will be less than 2%. And then bone marrow biopsy can also result in normocytic anemia as well, and this will cause the reticulocyte count to be very, 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 very low. So if the reticulocyte is very, very low, because the bone marrow is not producing enough reticulocytes, there can be an issue with the bone marrow. And you can have something called pancytopenia, where you're not only not making enough red blood cells, but you're not making enough white blood cells, and you're not making enough platelets as well. So you can have something called aplastic anemia, where you're not making enough red blood cells, white blood cells, and platelets. And you can also have something called myeloblastic syndrome, whereby you are again not making any of these cells because you have a lot of like premature blast cells that are crowding up the bone marrow and not allowing enough space to make the other cells like red blood cells, white blood cells, and platelets. So again, bone marrow biopsy can check for problems with the bone marrow as well. And then for macrocytic anemia, there are a few causes that can take place. For example, as we already mentioned, you can have low levels of B12 and B9, just folate, and you already know how to differentiate between the two. First of all, check their levels to see if any of these are low, and if they're borderline, then you can check homocysteine and MMA, as I mentioned previously. If MMA and homocysteine are both high, that's indicative of B12 deficiency. If homocysteine is high but MMA is normal, that's indicative of B9 deficiency. For macrocytic anemia, you also want to check your thyroid, again for low T3 and low T4, which can indicate hypothyrodism, which can lead to macrocytic cells, and also check for liver function. Check for liver function. Things like liver failure, liver cirrhosis. Okay. Other things that can cause macrocytic cells include things like drugs and alcohol as well. So it's very important to get their history to see if they're taking any drugs, specifically drugs that interfere with DNA synthesis. Drugs that interfere with DNA synthesis. And these include things like methotrexate, which is used for cancer, right? You're inhibiting the synthesis of cancer cells, but you can also inhibit the DNA synthesis process of normal cells. So things like chemotherapy, things like methotrexate, as I mentioned. There's even hydroxyurea that's used for sickle cell anemia, but that can also cause this issue. And there's other things as well, like various antibiotics, even anti-seizure medications can cause this. So doing a proper history to see if they're taking any medications, like any antibiotics, any HIV meds, seizure medications, chemotherapy, and also checking their alcohol level in the blood as well can help determine if they have a underproduction macrocytic situation. And there's another thing that I wanted to point out is how can you differentiate. So let's say RI is less than 2%. Let's say the cells are macrocytic, so above 100 femtoliters. How can you determine exactly which of these they have? Well, you can check these levels of B12 and B9. You can check T3 and T4. You can check liver enzymes, ALT, AST, to look for liver function. You can check blood alcohol concentration. You can, in the history, ask them if they're taking any drugs, medications, right? But you can also do a peripheral blood smear, PBS, and you can check something for hypersegmented neutrophils. So these are neutrophils that have a lot of lobes. So if these neutrophils have more than 5 lobes, that's indicative of B vitamin deficiency anemia, specifically B9 and B12, right? So doing a peripheral blood smear can also help you determine that the reason for their macrocytosis underproduction is B9 and B12 deficiency. And if they have less than 5 lobes, then you know it's not a B9, B12, then it's the other reason. What are those other reasons? Thyroid, liver, and drugs, medication, right? Alcohol. Now this is really interesting because some medications and even alcohol, if they inhibit DNA synthesis, then similarly to B9 and B12, they can cause a hypersegmented neutrophil situation. So depending on the type of drugs, if you're talking about things like methotrexate that impairs DNA synthesis, well, that's going to result in more than 5 lobes, right? Similar to a B9, B12 deficiency situation. But other drugs or thyroid problems, liver problems, or even problems with the bone marrow, right? Because myeloblastic dysplastic syndrome can also very rarely cause macrocytosis. Remember, I already mentioned it in the normocytic cases, but it can also be in the macrocytic. So bone marrow issues can also be present, right? So if there are less than 5 lobes, then it's good to check things like thyroid function, liver function, bone marrow, and drugs other than the drugs that impair your DNA synthesis, which are like chemotherapy drugs, because those are going to cause more than 5 lobes. And if they have more than 5 lobes, we call this megaloblastic macrocytosis, and this is due to B9, B12 deficiency and also chemotherapy drugs that impair DNA synthesis. If they have less than 5 lobes, we call this non-megaloblastic macrocytosis. For example, if they have 3 lobes, right, and this means that they don't have hypersegmented neutrophils, that they don't have polymorphonuclear leukocytes, so white blood cells that have a lot of these lobes or segments. And this is due, the non-megaloblastic is due to things like thyroid problems, liver problems, bone marrow problems, and various drugs and medications. Therefore, it's always good to check all of these things. Check your T3, T4, check your liver enzymes, check your bone marrow via bone marrow biopsy, and screen for any drugs or medications in the history that can cause this non-megaloblastic macrocytosis, like anti-seizure medications, for example. or antibiotics that they may be taking, like Bactrim. I hope this was helpful. I hope that you now understood all of the different situations for a reticulocyte index of less than 2%, whether it's micro, normal, or macrocytic, and I hope that you're now able to actually apply this to a situation. For example, if a patient comes to you with a reticulocyte index of less than 2%, and if they have macrocytosis, let's say 120 femtoliters, so that's above 100. So again, in this situation, we had hypersegmented neutrophils, and we had a situation with a reticulocyte index of less than 2%, and also macrocytosis. So the options for that, if we see hypersegmented neutrophils, that means that we have a megaloblastic anemia. So we can have a B12 deficiency, a B9 deficiency, or it can be due to drugs and medications that inhibit DNA synthesis, like methotrexate. But let's say in the case the client was not taking any drugs or medication, then these are the likely causes: B12 and B9 deficiency. So we check those levels, and if one of these is low, that will be suggestive of a deficiency. If both of these come out borderline, then we can run homocysteine and MMA tests, and we can determine which of these is more likely. Let's say both homocysteine and MMA were elevated. This is more suggestive of a B12 deficiency. So that's how you can go about these cases. I hope you guys enjoyed this video, and in a nutshell, you want to find the reticulocyte index, and if it's less than 2%, you want to find the size of the red blood cell, the MCV, and determine whether it's less than 80 femtoliters, between 80 and 100, or above 100 femtoliters, to determine the size. Do you have microcytosis? Do you have normocytic cells, or do you have macrocytosis? And with that, you can then determine which condition is most likely. So I hope you guys enjoyed this video, and until next time, take care.